Hi, everyone. Just to reintroduce myself, my name is Owodunni.
And my name is Ariana McLain.
We had the pleasure this summer of working with the SANS lab, and we would like to go over cerebral vascular complications and dural venous sinus segmentation. So one of the first projects that we got to work on was the blood biomarker study, which focuses on stroke. So specifically ischemic stroke, which is the narrowing and or complete blockage of blood vessels, which leads to a lack of blood flow that will ultimately lead to neuronal cell death, which will lead to temporary or permanent disabilities like weakness or paralysis. So stroke is one of the leading causes of death among adults. So it's really important for us to understand the mechanisms behind it and kind of just understand the research. So other research focuses on blood biomarkers of stroke patients, but they compare stroke patients to healthy patients or patients who just haven't had a stroke. What makes our research unique is that we have our own patients be the controls. So we compare their blood biomarkers before they had a stroke and if they were to have a stroke. We could do this because aortic hemiarch replacement surgery was found to increase the likelihood of a patient having a stroke. So we chose to use them as our population. So to do this, we collect blood and urine samples throughout the surgery from the aortic hemiarch replacement patients, but we also collect from patients undergoing coronary artery bypass grafts because they are having heart surgery just without the risk of stroke. So we can compare their blood markers to make sure that what we find might not be attributed to having heart surgery and more so to having stroke. So we detect these blood biomarkers that may indicate stroke, and some of them are shown up here. And we really want to focus on early detection of stroke because it's really important that you catch stroke early and you're able to treat it, because the longer the stroke occurs, the more damage that can be done. And we want to do this through developing a blood test. That's the ultimate goal. But right now, we're kind of just looking at the mechanisms behind it. So urine is collected before and after the surgery, and that's immediately stored. And then we isolate plasma and serum from blood in order to, through centrifugation. And then we take those samples that we've prepped and we work with Olink to undergo proteometric analysis. We're looking at 200 proteins of interest currently. And then after the patients undergo the surgery, a couple of days later, they undergo a research MRI. And this is basically just to look for ischemia. And it turns out that a lot of the patients actually show some degree of ischemia. So the overall goal of the study is to really focus on quick detection of stroke so then we can increase patient outcomes and make that more positive with less damage. Another study that we had the chance to work on was the Biopsy Study. This study focuses on understanding the genetics and microbiology behind cerebral vascular diseases. And we do this through the analysis of biofluids and tissues. The study is broken up into two parts, but the first part I want to talk about is the endovascular biopsy part, which we look at materials from endovascular surgeries. This mainly includes the coils, which you can see over there in the aneurysm. So the coil is used to kind of block blood flow from the aneurysm. This is just to prevent rupture, and we have to make sure the coil fits or else some blood gets in there. So we have to, if the coil doesn't fit originally, they might take it out. And so we collect that coil and we isolate cells off of the coil, doing antibody staining, endothelial cells. And then we do flow cytometry on the cells, which basically measures the physical and chemical characteristics of the cells. And then we run 10x genomics, which is RNA sequencing, to understand the RNA expression. And the overall goal of this study is to really understand how cells respond to changes in blood flow. And we hope to be able to understand that because we want to, understand the mechanisms and predict when an aneurysm might rupture when there is that change of blood flow.
So some other collections of the tissue for tissue biopsies were from a craniotomy for a cavernous malformation resection of the left anterior temporal lobe and an aneurysm dome from an aneurysm clipping of the left M2. Those collections are placed in a freezer at -80°C, and those go to creating a tissue bank for further cell research into cerebrovascular diseases. Our final study was on the fluid modeling of cerebral blood flow. So how many people know what CFD is? Great. So it's computational fluid dynamics, which is a tool to help us better understand neurological disorders. It's a non-invasive way of measuring velocity, pressure, and fluid shear stress of inside blood vessels. So as you can see in figure 1, I have a depiction of a blood vessel, and on the inner portion of the vessel, it's red, which correlates with a higher velocity. And as you move closer to the wall of the vessel, it turns green, which is correlated with a lower velocity. And this is due to the frictional force that the fluid feels and causes a drag in the fluid that then causes a lower velocity, shown green. And so this CFD details the blood flow to help with the treatment and outcome of patients. As such, in figure 2, you can see a blockage of the left transverse sinus. And right here, I have a beautiful shear stress equation that I know everybody's super eager to hear about. And so a CFD of the dural venous sinuses is a computational fluid dynamic of the dural venous sinuses, which are the sinuses that drain the venous blood from your brain. And you can see where the location of the dural venous sinuses is in figure 3. And below that, I have a CFD of the dural venous sinuses that will be used to calculate the high pressure differentials in cases as such, like idiopathic intracranial hypertension. You have treatments that include a shunt, which is a tube placed in the brain to help drain fluid away, or a stent, which is used to relieve stenosis. So by measuring these high pressure differentials, we can then determine if a patient is eligible for stenting, which is more ideal, versus a shunt. So the objective is to automate CFD to provide clinical utility. And to do this, we need a large data set of manually segmented anatomy to train machine learning that will then go into automating CFD for clinical usages. So this last summer, we used a program called Vmtk, and that stands for Vascular Modeling Toolkit, and that manually segments the dural venous sinuses that then go into training, training machine learning, and then that automates CFD for clinical usages. Which basically means we took a magic school bus ride from the superior sagittal sinus to the jugular veins. And with that, our sincerest appreciation to the NSSSP program. We couldn't have done it without you guys. And thank you for your support and teaching us.
It was truly an amazing summer.